500,000 per day. That's the average number of new COVID cases being diagnosed coast to coast as the country wrestles with Omicron and continues to battle with Delta. Monday, a grim new record met in that department. 1,082,549 cases logged. America also hitting the highest 7-day average of daily new cases of any country tracked by Johns Hopkins University. Dr. Brad Pollack, epidemiologist and chairman of the Department of Public Health Services at UC Davis, with me live now to discuss where we are and where we're going at this stage of the pandemic. Good morning to you.
Good morning. Happy to be on.
Well, first, we know Omicron is much more transmissible than other variants, but more mild, at least for the vaccinated. But these cases are still exploding. What are your impressions of where we are with this illness?
Yeah, well, the transmissibility, we think it's about double what it was for Delta, and Delta was pretty bad. So the expectation was to have a variant like this that was going to be so easily spread to other folks. We knew there were going to be large numbers. I think, the issue is, what is it like today to be a case versus what was it like a year ago? A year ago, most of us were not vaccinated at all. Those of us who did get vaccinated today, thinking about the threat of being infected is a whole different world. I am personally not worried about dying or being hospitalized because I've been fully vaccinated and boosted. I couldn't have made that claim last year. So I think there's been a different issue about becoming a case, but there is no question we're seeing this massive onslaught now of new cases, which is what you'd expect when you get the bug that's mutated to become much more transmissible.
Vaccination and boosting, not quite, the relief it was though, because there are breakthrough cases. We know that they are more mild, but there still are those breakthrough cases. Now, people across our region are desperate to get tested. Very hard to do at drugstores. You can't buy home tests at drugstores. Yesterday, folks swarmed all of the Sacramento County Library locations because they were handing out free tests. Should we be this test focused right now?
Well, yes, I think testing is good. We've been articulating that message consistently now for a year and a half. Excuse me, in Davis. We've had a very successful campaign with our Healthy Davis Together program to get people to come in and get regularly tested. So it's important. It's still important today. I think what we're talking about right now, though, is people that were gathering for the holidays, coming back from vacation. There's no question that the surge you're seeing right now in demand is largely a result of that mixing that we did, that travel that we did, being around others. So that's driving this. And I expect actually in the next couple of days that the level of testing demand will go down a little bit, but it's still going to be very, very high. And there is an expression that we use in epidemiology: you can't test your way out of an epidemic or a pandemic. It's true. The health behavior part of it is very important also. So the testing is done in order for us to do the right health behaviors. If we're positive, if we think we're infected, we don't want to go out and mix and expose other people. And that's really the value of testing, is to make sure people don't transmit to others.
Well, since Omicron is moving through so much of the population so fast, I've heard a lot of experts say in 6 to 8 weeks, we're really going to be in a much better place with all of this, a sort of run its course with the worst scenario. Do you agree?
Yes, there's no question that, as we've seen with these newer variants, they hit us harder. They're more transmissible. They hit us harder, but that means they hit us harder all at once and faster. And so with Delta, we saw a surge that was really expanded over about 3 or 4 months. With this particular variant, Omicron, we're expecting this to be very fast. I mean, you're going to see this thing peak probably in another week, 2 weeks, and then the numbers will start coming down. And that's not just what we predict here, but it's really based on what we saw in South Africa, where they had the first cases and the big surge. And that's kind of the nature of a bug that gets to be more transmissible, is that you have faster, more infection happening all at once. Unfortunately, while this may be a milder bug, the problem is if people are infected, it takes them out of the workforce. And of course, we're concerned in healthcare that we've got healthcare workers that can't report to work because they're infected. So that's really the fear, is having all these cases all at once. But as fast as this thing has come on, it will probably go down at the same rate. So we should be out of the woods probably in about 2 months in terms of the big numbers.
Well, that is good news, but a new variant has just been identified in the Marseille region of France. Right now it's being called IHU. It's supposed to have more mutations than Omicron, but so far the WHO hasn't labeled it a variant of concern. So for us non-doctors, how do we assign concern about a variant versus a so-called scariant?
Well, yes. So hopefully the non-doctors won't be assigning that. It really is based on how fast a particular variant is being transmitted in the population. So that's really the major determinant there. And we've had some other variants here that were variants of concern officially, but didn't really pan out to be a major threat for us. So that's very possible. You're going to have mutations going on. The larger the pool of people around the globe that are not protected, the larger the opportunity is for the virus to mutate. So you're going to see variants occur, these mutations occur. It's kind of part of the evolution of the virus. The issue is whether it gets to a threshold where it's really infecting people much more commonly than the current circulating variant there. And again, depending on what kinds of immunity people develop based on either prior infection with another variant or the vaccination, that will also dictate the dynamics of a new mutation actually becoming something that would become a variant of concern.
All righty, so much for all of us to watch all the time. We know it's exhausting. Everybody has pandemic fatigue, but there really isn't a way to get around having to pay attention continually to all of these developments. Thank you so much for helping us stay on top of it.
My pleasure.